October is National Breast Cancer Awareness Month, and it's a great reminder that all women need to be on the lookout for the signs of the disease. Dr. Roz is here with ways to help us learn how to spot symptoms of breast cancer. Welcome.
Well, great to be here.
It's great to have you here. You're all decked out in pink for the cause.
I am.
It is Go Pink Month, isn't it?
Absolutely.
So you have a lot of patients that come in. I think, one of the things you probably ask you a lot is, I don't need to worry about that till I'm older, right?
Well, you get that question,
Yeah.
well, that response, but
Sure.
you have to direct your patients to what's right.
Yeah.
And the recommendations for breast cancer screening is definitely a screening mammography at the age of 40.
Okay.
However, that can change depending on the history, the family history
Sure.
of that patient. So it changes between patients.
Okay, so that's something that you will work with your patients on a case-by-case basis as they talk
Exactly.
about family history.
Right. And with the family history, if there's a primary relative, and how do you define that? That's in a mother or a sister who developed breast cancer, then you want to do that 10 years prior to the age 40 that I mentioned.
Okay.
For example, if you have a sister who's age 45 who developed breast cancer, then the screening for that patient is going to be 10 years prior, so that's going to be at age 35.
That makes sense.
Yes.
So some other risk factors and things as we talk about breast cancer symptoms, stuff like that.
Yeah. Well, the most common risk for breast cancer, and a lot of people don't associate it with, is obesity.
Oh, really?
Obesity is the #1 cause of breast cancer in America.
I did not know that.
It is fact. So what's important, what I stress to my patients, the importance of exercise. We use it for a lot to lose weight, but,
Sure.
it's really good for our health. And the reason, what you may not make the connection, is that metabolites in our body live in our fat cells. And so when you shrink those cells and get junk out of the cells, it helps
Yeah.
with preventing breast cancer, believe it or not.
Which is a great, great thing. So
Yes.
a healthy diet, exercise is always going to help us in any aspect of the life, but especially for breast cancer risks.
Yes, as well as vitamin D.
Okay.
There's been great studies taking vitamin D3 on a regular basis, and if keeping a level around 60 to 80 help decrease the woman's chance of developing breast cancer by 50%.
Wow.
Yes, and if you exercise on top of that, it's 70%. So there's a reason to be out in the sun to get the
Yeah.
vitamin D, and maybe go for a little jog, and that's during your exercise.
Yeah.
But it's important. All of these things matter. There's a connection there to help lower your breast cancer risk.
Any other things we can do as we're considering a healthy lifestyle, and really if we do have some hereditary symptoms in our family, other things we can do?
Yeah, well, diet definitely matters, not only from the obesity standpoint, but there are certain vegetables you just want to get in. Those are your cruciferous vegetables. Broccoli is one of the good ones.
Okay.
Indole-3 carbinol, that's the active ingredient in it that actually helps lower your breast cancer risk. Just a small little fact, there's a pharmaceutical company that wanted to package it up, put it in a pill, and sell it as breast cancer prevention. FDA said no, it's food. So what do? You eat more broccoli.
Yeah.
Yeah, eat more green vegetables.
Eat more greens.
Yes.
We've got some information up on the screen. 1 in 8 women are diagnosed with breast cancer. Talk a little bit about some of the facts we're seeing there.
Yeah, well, 1 in 8 women are diagnosed with breast cancer in their lifetime. And so that's pretty significant. But 1 in 20 will actually die from that disease. So the whole thing about breast cancer awareness is to lower that mortality rate by making detections early.
Yeah.
And in that case, it's not as aggressive, and the chances of a woman dying from that disease is going to be less. So it's all about early detection. That's what this whole awareness is about this month.
And
Yeah.
that's why people are wearing pink, why people are promoting so much during this month.
Exactly.
Really, really getting in there, especially if you've had a family history or any of the symptoms that you mentioned, getting yourself back on track.
Absolutely.
You have a new website that you want to direct people to that can kind of help, and if you have more questions, where can we visit you?
And that's going to be info@drrozmd.com.
Okay.
And you'll also find information. I'm going to be a part of the Breast Cancer Awareness Walk, and come and join me in that walk on October 17th.
Oh, excellent.
Great. Awesome.
Fantastic. Dr. Roz, wonderful
Great.
to have you here. Thank you so much.